Across the Bay Area, mental health providers have been taking labor actions. At Kaiser Permanente facilities across California, mental health providers were set to launch a week-long strike between November 11th and November 15th to protest what they described as long wait times for mental health clients seeking services. Matt Hannon, a psychologist working for Kaiser in South San Francisco, said that patients sometimes have wait times of 4 weeks or longer, something, Hannon said, that prevents them from getting the care they need.
And as therapists, we want our patients to get better, and we want to work in a system that provides patients with the opportunity to receive frequent and timely mental health care based on their clinical needs.
That strike was postponed on November 10th due to the death of Kaiser CEO Bernard Tyson. And in Santa Clara County, workers across the county government went on strike to protest a slate of what they described as unfair labor practices. One of their allegations centered around a proposed move of a facility called the Family Resource Center away from East San Jose. That proposal drew criticism among staff that the county was moving vital services away from the places where they were needed. Since then, the Santa Clara County Board of Supervisors has suspended the proposed move, and the union has halted the strike, agreeing to go into mediation with the county to negotiate a new contract. But the County Workers Union, SEIU Local 521, also stated that the county has had high levels of vacancies across the government. As many as 1 in 7 positions across the county were vacant, the union stated in an October flyer. And according to figures from the union, the vacancy rate is higher among mental health providers, where nearly 1 in 4 positions were vacant in October. Mental health providers I spoke to cited a number of reasons for the high turnover and vacancy rates. For people working at the jails especially, high caseloads and a stressful work environment can make it hard to recruit and retain staff, Santa Clara County employees said. According to Charlene Mahabali, a marriage and family therapist at the main jail, the severely mentally ill population in jails will often push and kick at staff
violent,
members.
they're kicking, pushing staff, spitting on them, things like this, and a lot of people get turned away from that, and they leave the county to go to somewhere that might be more of an office space with less violence in that way.
And Alan Yagubi said that the physical environment of the jail can make it hard to recruit mental health providers into corrections jobs.
So, we're in a concrete building with no windows. Movement, just moving around in the jail, in the facility, is very restricted because all the doors are locked and controlled by an entity in what we call a control room, where they unlock and lock all the doors. Even the elevator, there are no buttons on the elevator. You step onto the elevator, you have to show to a camera what floor you want to go to with your hand.
Outside of the jails, Karen Parsons, a psychiatric social worker, said that the high cost of living is the main driver causing people to leave. Several of Parsons' co-workers, she said, have had to have several roommates in order to be able to afford to live in the South Bay, close to work.
That's really the main reason why people leave, is just they can't afford to stay.
For others, the cost of living can mean taking on other jobs or commuting long distances to work. Mohammed Barete, who works as a mental health worker in emergency psychiatric services at Valley Medical Center, said, for instance, that he works 2 jobs and lives outside of Santa Clara County.
Most of us don't live in the area because we cannot afford it.
Yeah.
So like I work in Santa Clara and I live in Hayward. And a lot of my co-workers do the same.
And this level of turnover, Parsons said, can affect care. In the mental health sphere, she said, you can tell how well a client's mental health will improve based on how well they like their provider.
For clients, one of the best indicators that their treatment is going to work is that, within the first couple of sessions, they like the person who they're in the room with. And so I think that alone just sort of speaks to how important it is to retain people who are providing services in the first place.
Mahabali emphasized that she cares deeply and is proud of the work she and her coworkers do. But like the other mental health providers I spoke to said, she hoped the strike would cause the county to address the problems that have led to high turnover and vacancy rates.
Like I said, I've been there for 13 years. I don't want to leave. It's because I'm proud to work for the county. I'm proud to do what I do. I'm proud to be a mental health worker. But just right now, with everything going on, we want to be able to provide more resources for our population.
For Peninsula Press, I'm Max Lee.